Thanks for tuning in to our next Ask Me Anything session, which is about dry eye today. My name is Dr. Eric Sweet. I am an ophthalmologist with Baptist Eye Surgeons, of course, and we'll be discussing dry eye, answering some of our patients' questions. So first question is, can you explain what dry eye is? And that's a great starting question, and absolutely I can, but understanding dry eye is best understood if you know how the normal tear film works. So a healthy eye should have a normal tear film over its surface at all times. And this tear film is not just water, but it has substances from multiple different sources. So the first substance is something called mucin. That's made by your conjunctiva, which you may have heard of conjunctivitis. The conjunctiva is the skin of your eye, and that produces mucin. And then there's glands around your eye. There's a very large gland and then multiple smaller glands that produce the watery component of your tear film. In addition, your eyelids have dozens of glands that are producing an oily component to the tear film. And all three of these components kind of mix up together to form a healthy tear that protects the eye. In addition, you need to have a strong, adequate blink that spreads that tear film out across the eye and covers the entirety of the eye to protect it. So what is dry eye or dry eye disease? It's merely a disruption in what I say the quantity or the quality of this tear film that normally covers the eye. And it often leads to a variety of symptoms for patients, which depending on the cause, can be different from one patient to the other. So the next patient asks, how do I know if I have dry eye? And when patients come into the clinic here and I'm talking to them, I can usually tell within less than a minute in talking to them if they suffer from dry eye, because the symptoms often tell the story. So patients will have a variety of symptoms from dry eye that can be indicative of a dry eye disease. The most common that we see is what I call a foreign body sensation, because it's as if a foreign body is in the eye. People describe it like an eyelash in the eye, but they'll have pain, usually sharp pain, a gritty sensation to the eye. The eyes feel dry or sandy or dusty. And that is a common presentation to dry eye. But other people their eyes don't feel dry necessarily. They wouldn't come in and say, my eyes feel dry. They have other symptoms. So some of those other symptoms would be intermittent blurring of vision. People say, I'm on my phone for 15, 20 minutes or longer, and things start to get a little bit blurry. And that's a very common sign of dry eye. That also happens with television or reading books, especially with our avid readers. Another sign is people say, my eyes feel heavy, they feel pressure around the eyes at times, and often those are intermittent. People will wake up with a crusting of their eyelids. They have to pull, what they often say, goop or mucus from around the eye to get comfortable in the morning. Other signs can be watery eyes or pain, and like I said, intermittent blurring of vision, even at distance. So you may be driving and have a little bit of blurry vision, you have to blink it away, and then the vision comes back. These are all signs of dry eye. So another patient asks, I'm told I have dry eye, but my eyes water a lot. Is this related? And watery eyes is something you would not expect to have if you're told your eyes are dry, but they actually are indeed related. So as I mentioned before, there are multiple components of a normal, healthy tear film. And water is only one of those components. So the eye needs the oil, the mucin, and the water to have a healthy film over it and keep the eye protected and comfortable. What can happen if someone has a poor oil layer or oil secretion from their eyelids, then what tears they do have can evaporate quickly and the eyes dry out. When the eyes dry out in these people, they often have a robust water response. So their body is able to make that water real quickly, thus the tearing. But the oil, for instance, is not made quickly. So So what happens is they have a poor tear film, mostly because of the oil. The body can respond with water, and then the patient gets tearing. And as you can understand, that can be confusing to be told you have dry eye when your eyes are watering a lot. But actually, dry eye is the most common cause of watery eyes, though there are other causes that need to be evaluated if that's a symptom that you're experiencing. So what causes dry eye? It's a great question. Dry eye is very common and has a lot of different causes. The causes can be, a list a mile long, but I'll go over some of the common causes. I would say the most common cause of dry eye is probably inflammation of the eyelids and the glands of the eyelids. So that oil that I mentioned is produced in what's called meibomian glands, and people can have a dysfunction or inflammation of those glands so that oil is not being adequately secreted into the tear film. So while their body can produce the water and the mucin, they don't produce the oil, and that leads to dry eye. So in these cases, we need to not only treat the dryness, but also the gland dysfunction so that the body can get back to a regular state and produce its own oil. Another common cause of dry eye is aging and hormonal changes. We see dry eye in teenagers, 20-year-olds, but the older you get, 50s, 60s, 70s, the more common dry eye is. Unlike gland inflammation, we can't treat aging, so we have to treat the dry eye and the patient's symptoms. Medications are a very common cause of dry eye that we see. Antihistamine medications, cold and congestion medications, antidepressant medications, even blood pressure medications. I would say with the number of medications that most patients are on, there's probably one medication that many patients are on that's causing dry eye. And a lot of times we can't stop that medication, but sometimes we can consider changing the medication or decreasing the dose so that the patient is on the lowest dose that treats their other problems. Allergies is a cause of dry eye, especially here in eastern Tennessee. We have some of the worst allergies in the country. And allergies lead to eyelid inflammation, which causes dry eye, can also directly lead to dry eye. Environmental exposures cause dry eye, and this may be just having a fan on around your house or while you sleep. It can be out in windy conditions or having the air conditioning or heat in your car blowing at your face. It can be working in dusty environments. Other times it's more individualized. So someone who's on a CPAP machine for sleep apnea, if there's any sort of leaks, that can lead to dry eye, or it can be, pulling on the eyelids or not letting the eyelids close properly. Those are causes of dry eye as well. So I would say those are the common causes of dry eye, but we see it in patients with autoimmune disease as well, and sometimes other ocular conditions. Another common thing that we see with dry eye is the history of surgery, and that may be cataract surgery, glaucoma surgery, a retina surgery, or even a distant refractive surgery like LASIK or PRK. Often those patients, because they've had basically a medically induced trauma to the eye, can experience dry eye. And sometimes it's most significant after those surgical procedures, but other times it's more chronic, long-term, it's down the road years later. So that's another place that we see dry eye. So someone asks, are over-the-counter drops okay to use for every case of dry eye? And the answer is not always. So I often have my patients start with over-the-counter drops. There are a variety of drops. If you've ever been to the eye drop section of a Walmart, Walgreens, you might be overwhelmed at the selection there. So some of those drops can be very beneficial for a lot of people. In fact, mild, early, or asymptomatic dry eye can often do very well with over-the-counter basic drop. But there are some drops there that can be ineffective for your cause of dry eye. And other drops can be detrimental and worsen your dry eye. So it's important sometimes to have a diagnosis, a reason, and understand the underlying cause, as what's over the counter may not be right for you. Though, again, for most people, it's a good place to start. But it also is a reason why, if you're treating your dry eye on your own and it's not getting better, or it's certainly if it's getting worse, that you need to be seen. So another patient asks, what are some of the treatment options for dry eye? And that really depends on the cause and the patient. Here I try to take a patient-centered, individualized approach to the treatment of dry eye, but there are some very common treatments that can be implemented in a stepwise fashion. So as we've discussed, there are over-the-counter medications, and those start as simple tear replacements, artificial tears, a drop that can be used, a couple times a day, depending on the seriousness of the condition, the frequency, and if there's any environmental exposures. There are also stronger drops. There are gel drops that are thicker, can last longer, and in certain cases are more beneficial. There are also over-the-counter ointments that can be put in the eyelid in patients that have more severe dry eye. And some of these come with side effects. So the most common issue with the thicker drops or the gel is that they, as you can imagine, like putting Vaseline on your eye, they can cloud your vision. So that needs to be balanced. There are prescription medications that many patients really benefit from. Some of the medications may be a short-term burst of treatment to tackle or improve an acute or short-term flare of dry eye or worsening, especially seasonal problems. There are also long-term medications that patients can be on that help prevent and suppress dry eye and the inflammation that can cause it. There are some procedural interventions that may be undertaken. In the corner of everybody's eyelids are little holes where the fluid on the eye leaves and it goes into the nasal cavity. And oftentimes patients who are not producing a sufficient quantity of tears, I can go in and put little plugs into those holes. And that's a procedure that's done in the office here and is pretty quick. And that can be helpful to patients with dry eye. Some patients, there's an interesting treatment that we can employ where we'll have a patient have their blood drawn, and then we centrifuge, or we have the blood centrifuged down and the red blood cells and the cellular components taken out. And then the rest of it, which is called your serum, is used to have on your own eye, only for yourself, as an artificial tear. And because of the biochemical molecules and components of that serum, people do really well when they have very severe dry eye. Each of these treatments, have variable levels of efficacy and cost, and we try to treat a patient appropriately to what their needs are. Most importantly, as I mentioned, identifying underlying causes and treating those is important as well. So a patient asks, does dry eye require surgery? And I would say only in very rare circumstances would somebody with dry eye actually require a surgery. And usually that surgery would be for something else that is causing the dry eye. For instance, if somebody had something like a Bell's palsy or a paralysis to their ocular muscles or eye muscles, or an inability to close the eye, scouring, trauma, that kind of thing, a surgical procedure may be undertaken to close the eye, usually temporarily, in order to give lubrication and reduce the exposure to the eye. Some patients have an exacerbation or worse dry eye because of the position of their eyelids, which may be turned in, turned out. They prevent good blinking. They prevent a good tear film from developing on the eye, and an eyelid surgery may benefit. But your standard isolated dry eye, typically would not require a surgical intervention. Another patient asks, I deal with dry eye along with seasonal allergies. Do you have any advice for managing this? And allergies can be tricky. Again, as I mentioned, they're very common in eastern Tennessee here to have significant allergies, not just with nasal congestion, but also affecting the eyes. Some of these patients, again, are asymptomatic, where they don't experience many ocular problems. They're not complaining of the symptoms I mentioned, but when I look at the eyes, I can tell that there's an allergic component to their vision or to their comfort levels. Other patients will have really itchy eyes. They feel like they want to touch their eyes all of the time, and that's a more obvious aspect of allergies. The interesting thing about allergies is the most common, the mainstay treatment, which is over-the-counter antihistamines, such as Zyrtec, Claritin, Allegra. Those can actually, if you remember, they can worsen dry eye by reducing the tear production of the eye. So while having aggressive allergy treatment can control the allergies, it may come at the expense of worsening the dry eye. So it's a matter of finding the balance. So do I have any recommendations for this? Yes. If the eyes are itching, if itching is a predominant feature of the symptoms, I often recommend an over-the-counter antihistamine drop that can be put in the eye. An example of that would be Zatador or Pataday. Hope that's helpful. So are there things that can make someone's dry eye worse? And yes, there are. As I mentioned, environmental exposures can make dry eye worse. So if you have dry eye and you have a fan going a lot, or your air conditioning is blowing on where you sit at home, it might be time for some changes there. If you smoke and are suffering from dry eye, smoking is something that can worsen dry eye in terms of behavior. Not wearing sunglasses sometimes outside can worsen dry eye because wind is a cause of dry eye. So wearing sunglasses can help when you're outside. Not wearing them is going to predispose you to worsening. People spend a lot of time on their phones these days, and spending a lot of time on your phone, mostly because you're focusing, you're not blinking as much as you normally would, can actually lead to dry eye symptoms. So for those cases, I often recommend, especially and with computers as well, you take breaks. It's good for eye strain. It's also good for the dryness. So every 2 hours, for instance, you could take a little bit of a break. Even sooner than that, if you're spending 20 minutes at a time on your phone, it's good to look up, make sure you're blinking, look around, and then go back to work on your phone or tablet or computer. So somebody else asks, are there underlying conditions that can lead to dry eye? I've touched on this a little bit. There are some, as I mentioned, eyelid issues. What people ask a lot is are my cataracts causing these symptoms? And the answer is usually no, though cataracts and dryness can both cause light sensitivity and irritation with light. Cataracts do not cause pain in the eye. They don't cause sharp pain. Another question is glaucoma. Is this a symptom of my glaucoma or macular degeneration? And all three of those big ones, cataract, glaucoma, macular degeneration, usually do not share a large amount of symptoms with dry eye. They don't cause the pain. They don't cause irritation. They don't feel like something's in the eye. Now, they can cause vision changes, light sensitivity, but the typical complaints that dry eye patients have are not the same as cataract, glaucoma, macular degeneration. There are some systemic diseases that can cause dry eye. As I mentioned, hormonal changes, menopause can cause dry eye. Autoimmune diseases. Usually patients have those diagnosed before dry eye, but sometimes we have patients who, especially younger patients in their 30s, who have dry eye and then end up leading to a diagnosis of an autoimmune disease, such as lupus or rheumatoid arthritis. There's something called Sjogren's syndrome as well, which can lead to dryness of the eyes. I should also mention on that there are problems with the eyes that can mimic the symptoms of dry eye that are not dry eye. So Uveitis, which is an inflammation inside of the eye. It's not the surface of the eye, it's in the eye. Can often have issues, light sensitivity, irritation. Another thing is a corneal ulcer or infection can mimic the signs of dry eye with the pain, irritation, gritty feelings. So I encourage my patients and people who are experiencing significant problems to come in. Let me take a look, make sure it's dry eye, make sure it's not an ulcer, make sure it's not uveitis, inflammation in the eye, something more serious. Another thing is herpetic eye disease or herpetic infections in the eye can cause similar symptoms. And all three of those can actually be conditions that can lead to permanent vision loss, which is why it's important if the dry eye is not controlled, and certainly if it's worsening with treatment, to come in and we can take a look and make sure it's not anything else. So I think that is all of our questions for this session today. I hope that I was able to answer your questions and help you in regards to your dry eye. We will be doing more sessions like this in the future, so find us on Facebook and online and post your questions that you have. If anything is not answered during this session, feel free to post below and we can answer your questions. If you have more serious concerns, please come in, let us take a look, and make sure that your eyes are doing well, staying healthy. All right, have a blessed day. Thank you.